Your doctor can save your life by taking a small blood sample. That sample holds the clues to your risk for heart disease, the leading cause of death for men and women in the United States. Dr. Seth Baum of Boca Raton Regional Hospital is here to take us through what doctors can learn in the lab. A very interesting point here. First of all, doctor, thank you for joining us.
Thank you for having me.
Let's talk about advanced lipid testing. What is that?
Standard lipid testing looks at cholesterol, triglycerides, LDL cholesterol, and HDL cholesterol. And what that means is, since cholesterol and triglycerides can't travel around the body outside of a particle, they have to be particularized. These are particularized in order called lipoproteins. LDL particle is how many of these particles we have in our body. Turns out that's actually more important than how much cholesterol you have in the LDL particle. So knowing LDL particle number can show us that you're at increased risk, we can treat you better, we can lower your risk, so it can actually save lives. That's one example.
All by a little
little trip to the lab.
Gotcha. Let's also talk about blood biomarkers. Explain what they are.
Blood biomarkers, in our body we have biological substances that can tend to track along with disease. When these biomarkers are high, they can give us a clue that you may be at risk for these diseases. So those are what biomarkers are. They're not classic risk factors. I should also mention, and I should have mentioned before, that the National Lipid Association, which is a very important organization in the United States, is having a very big outreach program, to make people aware of something called FH, or familial hypercholesterolemia, which puts them at great risk for cardiovascular disease, and we'll see that in some of these tests. So we should be aware of that.
I was going to say, frequency of testing. You know, people always want to know their cholesterol level at some point in their life. How often should testing like this happen?
Well, it's interesting you asked that. We just recently had changes in our specifications. We now say that we should test people who are at risk even when they're 10 years old. So we need to be looking at this much more aggressively. I would say annually for people who are older, but it's certainly youngsters should be screened when they're at risk.
Important you say youngsters all the way up to the elderly. When it all comes down to it, how can these really save a person's life, these kind of tests?
Well, we have a number of different risk factors. We're always trying to reclassify patients. So there are different systems for classifying risk. We then want to go beyond that. These biomarkers, these advanced lipid tests, using the National Lipid Association criteria, all these things enable your doctor to be able to take you and say, you're actually at higher risk than we would have thought, we'll treat you more aggressively. That translates into a lower risk for heart attack, stroke, and sudden death.
Okay. All very interesting to definitely get those screenings done, and that's what's it's taken. That's Dr. Baum. Thank you so much for joining us again. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.